You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, weight loss. With us, we have a medical doctor that is getting incredible results with his patients. He says he treats obesity or overweight as a disease, and he uses a combination of medications to wipe out cravings. If you think you've tried everything, unhappy with your weight, my advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. My first guest is Robert Skversky. Dr. Skversky is a medical doctor that treats obesity as a disease, and he's getting incredible results, both in Orange County and Temecula, California. Dr. Skversky, welcome to the program.
Good morning.
Now, before we get started, I guess you're the founder, medical director of Weight No More.
Correct.
And so tell me a little bit about it.
Well, Randy, I've devoted the past 16 years of my professional career to the medical treatment of the overweight and obese patient. Okay. And basically, I treat obesity like a chronic metabolic disease that has a significant genetic predisposition.
So all you do is weight loss. I mean, that's your specialty in your practice.
Primarily weight loss, bariatric medicine.
Now, you've been featured on Today's Show, The Early Show, Good Morning America, Wall Street Journal, because you have a different, look, I interview medical doctors nationwide, and when we talk on the phone, I've never heard what you have to say before, which is, in a way, good news for overweight people. But why don't you tell me a little bit about why you were on Today's Show, Early Show, Good Morning America?
Well, basically, diet and exercise, which have been the traditional paradigms for weight loss in this country forever, from my perspective and based on many studies, have shown themselves to be ineffective for the vast majority of patients. And the shows that I was on were basically profiling the medical treatment for being overweight and the treatment that is used, using medications often in an off-label manner to treat obesity as a chronic disease, just like we treat diabetes or hypertension.
So you use medications in your practice? You say over 20 different medications.
Well, about 15 different medications, okay. But some of them are in various classifications, such as anorectic agents or appetite suppressants, antidepressant agents, anticonvulsant agents, and diabetic medications are usually the combinations that we can use in our patients.
You say diets don't work, that diet and exercise don't work.
I say that diet and exercise are a very important aspect, possibly essential components of any long-term weight loss program.
Okay.
But on a long-term basis, they have shown to be ineffective for the vast majority of patients. And
as far as weight loss goes?
As far as weight loss goes. Any diet is going to work initially, Randy, because they're all based on caloric restriction. But long-term, they do not work for most of the people. There's a reason why commercial weight loss programs have a 95% failure rate at 4 to 5 years. Yes.
Okay.
There's a reason why Weight Watchers, which may be a very good nutritional program and good support for the people there, have an average weight loss after weekly meetings of 2 years of about 6 pounds.
Okay. Do you have patients that have kept it off for a long time?
Yes, we've had patients that have kept weight off for as long as 16 years because we've been doing this program for 16 years.
Okay, categories of patients that you see. You say you have different categories.
Right. Well, you don't have one typical patient, but the categories, there's a category, for example, of patients who have been overweight their whole life. Okay. From childhood to adulthood, their parents are overweight, their children are overweight, their brothers and sisters are overweight, and they have a very, very significant genetic...
They can be helped on your program?
Absolutely.
Okay.
Another category would be patients whose weight have been fairly stable for much of their lives, and I'm referring to the women, but based on pregnancy, based on going through perimenopause and menopause, hormonal changes, the weight gradually goes up.
So they can't lose weight the way they used to?
Right. Well, okay. As an example, as you go into the perimenopause, your hormone levels begin to decrease. And the body, in a physiologic attempt to increase estrogen, only has one option for the women, and that's to increase fat.
Interesting.
Because estrogen is stored in the fat cells.
And that can be turned around as well?
That can be treated as well.
Okay.
Another category would be all the patients that have been on fen-phen in years past and not being aware when those medicines were taken off the market, and I think it's important to discuss the ramifications and the conclusions of the original fen-phen study.
Because fen-phen did work.
Fen-phen
I guess the big debate is whether it was healthy or not.
Correct.
And it was taken off the market. Well, but you made a bold statement to me. You said that for people that were on fen-phen, and when it was taken off, they ballooned up again. Those are your
Right,
best
many
patients.
of those patients, well, not the best ones, because they're all my best patients.
Okay.
But many of the patients were unaware that other physicians in the country and myself simply changed the protocols.
How are you able to accomplish the same thing if those drugs are off the market?
Well, basically, what we've been doing for the last 11 years is to replace that which they took off the market, Pondamine and Redux. Phentermine has been on the market for 60 years. It's still one of the mainstays of treatment. we've replaced the meds that were taken off the market with other medicines that do the same thing, take a little bit longer to work, have a slightly different mechanism of action, and therefore do not have the rare significant side effects of the fen-phen program.
Now, you have big weight loss results, you say. In fact, we were quoting that, I guess on average, you brought a stack of papers with you, and we talked a little bit about them, that, some of these centers, let's say a Weight Watchers or Jenny Craig or whatever, and you jokingly said, when they leave my office, they lose about 6 pounds on the first consult. But how much weight do they lose per month? A large person.
Well, it doesn't matter whether they're large or small. The average weight loss initially in our program is easily 8 to 10 to 12 pounds, but it doesn't matter to me, I tell the patients, how much weight they lose or how quickly they lose it. I care that it's consistent, because getting the weight off has never been the problem in most diet programs. The problem, and the reason that diet and exercise do not work, is that long-term they're ineffective for good physiologic reasons. You often hear, Randy, that if I would decrease my caloric intake by 500 calories a day, then in a week I'd be down 3,500 calories, which is a pound, so I should lose a pound. And then in 4 weeks I should be down 4 pounds.
Isn't that true?
Absolutely not.
No. It's not calories in, calories out?
Absolutely. I don't agree.
That's ridiculous
The math,
to you?
it's not ridiculous, but it's not the full story.
Okay.
So although the math may be accurate, calories in, calories out, if your metabolism slows down, your weight loss is going to slow down also. It's no different than somebody who is normal weight and begins to increase their food intake. The metabolism speeds up to compensate.
Okay. Now, what about those doctors, medical doctors, that eat less, exercise more, and treat it as and I've talked to medical doctors that I said, what's your take on this obesity thing? They say it's just people are lazy and lack of discipline. What is your response to that?
I think that is absurd.
Really?
I mean, to think that we have 130 million Americans who are overweight in this country, and to think that they all are lazy, that the fact that they eat too much, they don't get enough exercise. There have been some interesting studies. The Haynes 1 study, for example, evaluated the eating habits of 22,000 overweight and obese patients. And they concluded that by and large, not to use that pun, but overweight people ate no more than their normal weight counterparts. Now, that may not have been the best study because a lot of it was self-reported.
On your Weight No More program, I mean, if you had to give me results, 50% of your patients reach their goal weight, 70%, 80% reach.
Well, the average weight loss in our program is very similar to the original fen-phen.
Is it
35, 36, 37 pounds, which means some people, as you might see, will lose 100 pounds or more.
Yeah, we have photos
But that
here.
is not the
80
typical
pounds,
patient. That's not
75.
the typical patient, because some people only need to lose 20 pounds. And for that person who needs to lose 20 pounds, it's as important as someone who needs to lose 50.
Do you get those kind of patients?
Absolutely.
Because that last 15 pounds, we always hear that story, is very difficult to get off.
Right. Well,
is that easy for you, by the way? A woman that's only 150 pounds needs to get down a little bit?
Well, if you're at 150 and you end up at 132 or 133, that's 17 pounds, that's 60,000 calories is amazing. Surely, if you have to lose 100 pounds, the first 30 pounds is easier than the next 30 that's easier than the next 30. We don't lose weight like this. You lose weight on a graduated fashion.
So they stay on their medications, and they continue to lose weight and continue to lose weight.
Until they reach, my hope is that most of our patients, admittedly, reach desirable weight range, not ideal. Okay, my weight is pretty good. I am well within desirable range. I am not ideal. Ideal body weight almost looks like malnutrition from American standards, but the lower you can get your weight, the better. But the key is to maintain the weight loss, and the studies are clear. You stop your medicine for any chronic disease, the disease returns. Why would it be any different for weight loss? So you give the lowest amount of medicine to maintain the weight loss. At one extreme, it might be a half of a phentermine 3 times a week. At the other extreme, the patient may be on phentermine, on an SSRI antidepressant, on an anticonvulsant drug that we use, and on an anti-diabetic drug.
So most of these things are off-label that you're doing? That means they're designed for one thing and you're using them
off-label.
To take care of cravings.
Well, more than cravings. These medicines work by suppressing appetite, controlling cravings, improving insulin sensitivity, since most overweight people are insulin resistant. Some of the medicines we use slow the absorption of carbohydrate into the system, and ultimately these drugs work by lowering what's referred to as your metabolic set point, which is kind of the body's genetic internal thermostat for what your weight is. Because people that are sensitive to the medicine will lose much more weight than the fact that they're just eating less and exercising more.
Do they feel deprived on your program?
Absolutely not, because our program is based on low carbohydrate intake.
Are they exhausted? Because oftentimes people are on a diet, they have no energy to do anything.
Actually, most of them have more energy because the appetite suppressant medications are stimulants. Now, we don't want to give them too much of the medication, make them difficult sleeping or increased
What if
nervous.
somebody says the problem with stimulants, cardiac stimulants in particular, can kind of wear out your heart?
Well, that's possible, but not with phentermine. There has never been a heart attack documented based on the use of phentermine. Now, that's at the dosing we're using. If somebody like ephedra, which was an over-the-counter stimulant, which actually worked for weight loss, although we never used it because it wasn't a prescription medicine, if you abuse any drug,
Yeah,
you know,
so
to the
phentermine
extent,
can be abused as well.
well, if you abuse the drug, of course.
What about things like, you know, the Atkins diet? They work, they control insulin.
Well, they
what
work
are your
initially,
thoughts?
but they don't work long term.
Okay.
The low-carb Atkins diet always wins the diet wars. But when you take that diet, which is very restrictive, 3 or 4 years out, the overall weight loss is not very much. In our program, I definitely stress low carbs. In fact, I have my patients do one main thing: count total grams of carbohydrate. The average intake in this country is over 300 grams a day. Atkins would have wanted you on 20, 30, 40. In our program, most patients I want to have between 130 and 140 grams a day.
So you give them a lot more carbohydrates.
Absolutely. Well, you need carbohydrates for the brain. About 40 grams of carbohydrate per meal would be acceptable of digestible
So combined with
carbohydrates.
medications, eating like this.
And we also need to discuss exercise, of course, because there's a
Okay.
lot of misinterpretation about exercise.
Are you treating the cause then? Are you going to the underlying cause of this obesity problem? I mean, is that how you feel?
Well, the cause in many, listen, genetic studies have
You
shown.
think it's a serotonin problem?
I think it's a combination problem. Surely there are many overweight people that overeat, but there are many skinny people that eat more than you and I, and they don't gain any weight.
That's true.
If I have a patient come into my office that is too thin, that needs to gain weight, and that happens maybe 2 or 3 times a year, for me to say to them, you know, you really have to eat more and exercise less, which is the opposite we tell my overweight patients, isn't doing them any favors.
That's interesting.
But
Good
one of the
point.
categories of patients that we forgot to mention are those patients who, because of various diseases, are put on medication that put weight on. There are a lot of drugs.
But don't things like Prozac or these reuptake inhibitors, don't they cause weight gain?
Well, why would I use a drug that causes weight gain in my practice?
I guess this is a big topic to talk about.
Well, there are many drugs that put weight on. Okay, the steroids, cortisone, prednisone, decadron.
Can you help those people?
Absolutely.
What about the people that just eat too much? We see those, they drink too much beer, they're just overeaters. Maybe
That's
they were
another
skinny
big
as
category.
kids.
There are definitely people that overeat, eat the wrong foods, processed foods, refined sugars, less exercise now than 20 years ago has been insult to injury to this obesity epidemic.
I mean, like the person that's overeating and going to fast food, everyone I think knows that's not ideal. But how do you break the habit? And on your program, do you have people that say, all of a sudden now I get to say no
if the
to those
medication,
things?
the medications work by suppressing appetite, which is part of it, and controlling your cravings and putting people in control.
And you're raising serotonin with other
And
medications.
in part, we're raising serotonin for the craving
So they could say
portion.
no to that.
They can say no to the cravings. People so often
So
give me the
logically now
response,
they could say, that's not good for me, I'm not going to eat
not
it.
that it's not good. They say this is must be how normal people feel. I'm not thinking about food all
Is
the
that-
time. I'm
they
not
say
craving. Absolutely. I
So
mean,
people
that's-
that are always thinking about food, that is,
it's
they tell you that.
biochemical. It's absolutely biochemical in many of these patients. But those are also some of the same people.
Is that common? They say that all the time, where they say, for the first time in my life,
I'm
I
in
have
control.
self-control?
I'm in control. So many, the thousands of fen-phen patients who had done so well, they felt so good in part because the appetite suppressant medication, in part because we were controlling their cravings, and they were also getting some of the antidepressant effects. You know, when you control someone's weight, not only do you help their weight, but you can help prevent or delay the onset of all these terrible comorbid conditions. All of the cardiovascular disease, the diabetes, the hypertension. We lose 300,000 people a year in this country due to obesity-related conditions. Most of them are cardiovascular in nature. If we can
So
get
by dropping the
down,
weight, they get healthier.
they get healthier, they can help to prevent or delay the onset of these other diseases. And the emotional aspects, the psychological, the prejudicial and discriminatory aspects of this disease have such a profound effect on the lives of these patients.
You say you're changing their self-esteem.
Changing their lives. If you were diabetic or you're hypertensive, you don't get blamed for having those problems. It's only with obesity that people
you're
get
lazy.
blamed or you're lazy.
Interesting.
And in some cases, that's true. You know,
I'm not endorsing you. I try not to endorse any of the doctors on the program. I'm just asking the question. We're going to take a quick break. We come back, the photos, and these are big weight loss photos. But before the break, final message. I mean, what's the number one thing people get out of your program?
There are several things. The major thing is improvement in self-esteem and empowerment and self-image, that they feel better about themselves, which makes the whole world
I mean,
seem
do
better
they tell
to
you?
them.
I mean, do you see them acting differently? Do they act differently? Are they dressing differently?
They are often very complimentary of my staff and myself and what we've been doing for them. And for example, I had a patient last week who she said to me, you know, I don't have to wear those baggy clothes anymore. I get into my, quotes, thin clothes. I can't wait to go shopping. I had another gentleman that came in 8 months ago at 515 pounds. He wasn't a candidate for surgical intervention at the present time. And I said to him, if we can get 100 pounds off, then if and when you can have the surgery, it would be that much easier for you as well as for the surgeon. He is now down 146 pounds, which is the exception to lose it that quickly after 8 months.
Wow.
He has now begun to leave his house and begin to go to classes to take various things that he's interested in. And he said to me, when I'm in these classes and the people see that I'm losing weight, they are so supportive. It is so wonderful to have that kind of support that I never really had before, and it just has changed my life. And he's still 370 pounds.
So your program is not just for the big obese. I mean, you have women that are like 150 pounds, 5'3", and they just want to get to 120 or 118.
Well, 20 pounds for some people, as I previously mentioned, is as important as 100 pounds to somebody else. However, you still have to qualify for the program. There's certain criteria. So some patients who want to lose 5, 10, or 15 pounds and their body fat is low, I'm not going to treat them. They really have to do it on their own. There's one other story I'd like to mention, though. And these are the stories that make everything I do even more than worthwhile. I had a patient who has been with us for about a year that unfortunately, due to a serious disease, being on chemotherapy, steroids, and other medicines to keep her disease in remission, had put on 60 pounds. And she was sent in by her oncologist. And I went in to see her after several months of doing well in the program, and I walked in and she was down about 55 pounds. I saw her last month. And she said to me, she said, "Doctor, can I give you a hug?" And I said, "Sure." So we hugged, and I said, "What's going on?" She said, "I want to tell you, my oncologist saved my life. And you, Dr. Skversky, have given me back my life." And I said to her, "You've made my day, you've made my week, you've made my year." I said,
I can see you almost get choked up telling the story.
It was just those kind of compliments, which we get more, frequently than maybe we deserve at times, are really just gives us the impetus to want to keep going.
What about the person, and we have to take a break, but somebody watching this, and they hear this, and they say, "But I've tried everything." How is his program any different? I mean, for the obvious reasons, you're using medications and diet, but what do you say to the person that just says, I've tried everything?
Many patients that we get have tried everything. If they have not been on an aggressive combination drug therapy program, then our program or some other physician in the country that's doing the same type of program, because I assume they have similar results, it's definitely worth doing. You've got to understand you have to treat this as a disease. I had a physician the other day that mentioned to one of my patients, "Well, it's mind over matter." That makes me crazy. It is not mind over matter. It's not simply how much you're eating.
Is that
or how much
insensitive
exercise. It is insensitive. Another area that's important to mention is exercise.
So you do believe in exercise, though?
Of course. Exercise is important in any weight loss program, but it needs to be put in perspective. If I want to lose a pound of fat and I weigh 180 pounds, for example, I would have to walk at 4 miles an hour for 8 hours and cover 32 miles to lose 1 pound. Or I could swim at for 7.5 miles at 25 yards per minute to lose 1 pound. To park your car further away in the parking lot or to take the stairs instead of the elevator.
So that's just silly to you? To give those recommendations?
Absolutely. Well, it's not, for weight loss it's silly. For many other reasons it's vitally important. Cardiovascular, strengthening, emotionally, psychologically, to elevate HDL, it's terrific. But for weight loss itself, it needs to be put in perspective, and there are always exceptions. There's some people that have that exercise gene.
But what if somebody says, you're just throwing medications at it? It's just a quick fix. And I could see that would be the attraction of your program. Then we air this, and people are saying, "Great, finally a guy's going to just give me medications, and that'll do all the work."
Our program is anything but a quick fix. That's the whole point of treating a disease as a chronic disease. The medications are lifelong. Patients say to me, "How long do I need to be on the medication?" I tell them until something better comes out. The studies are clear. Once again, if you stop your medication, almost without exception, the weight goes on. If it doesn't go on, I am thrilled. I never mind.
But you could go off the medication. Some people could go off.
Many patients go in and out of these programs, but that's never my recommendation, because when they stop the medication, the weight begins to go up. If I stopped medicine I was taking for diabetes, as an example, my blood sugar would go up. If I stopped my hypertensive medication, my pressure would go up. Why would you want to stop them?
Okay. Now, you've had celebrities, by the way. Celebrities have... And you say you don't want to talk about this, but you've had celebrities.
Yes, we've had some well-known people.
That when they want to lose weight, you're the go-to guy. This is very, very interesting. We're going to take a quick break. We have to show those photos and more about the process, what they can expect when they go to see you. You're watching The Wellness Hour. It's all about weight loss today with Dr. Skversky. We'll be right back.
Tried all sorts of cover-ups for bad breath? Try the science of BreathRx. Only BreathRx has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription BreathRx from your dental hygienist and now at fine stores everywhere.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light super activates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, big topic, all about weight loss. With us, we have Dr. Skversky. He is the founder and medical director of Weight No More. And you treat, for people just tuning in, I mean, you treat weight loss. I mean, you're very aggressive with weight loss.
Yes.
You attack cravings. You use medications, 16 different medications.
I treat it as a medical disease because it is a medical disease, just like I would treat the diabetic.
But 16 different medications?
Well, we use one of 50. There's a combination of medicines we use. Okay. Most patients take 2 medications, but we have up to 15 different medicines in different groups. Okay. There are 4 medicines in the antidepressant group we use.
Anything like carbohydrate blockers?
Not carbohydrate blockers per se, but one of the medicines that we use on occasion if needed is glucophage. It's an anti-diabetic medicine, and it not only does it take weight off, but it slows the absorption of carbohydrates into the system, and it improves insulin sensitivity, and most overweight people are insulin resistant.
Okay. Now, you have photos.
I have a bunch of photos. I just brought a few of them. Here's a gentleman, for example, who's down 62 pounds, been with us for about a year and a half, and as you could tell, you know, his clothes look a little baggy because he hasn't gone to the store to get new clothes yet.
He can tuck in his shirt and things like that?
Definitely, he can tuck it in his shirt now.
You mentioned something very interesting. With all things being equal on a job interview, the person that looks in shape...
Well, studies have shown that for every pound overweight somebody is at executive positions, it costs $1,000 in salary per year.
Really?
That's pretty significant.
Because you're judged. I mean, people judge you by the way they look.
Absolutely.
You say there's a prejudice against overweight people.
Well,
that's not fair.
It's absolutely unfair, and not only is there a prejudice, there's significant discrimination, and in no other disease are people discriminated as much, because if you're overweight, the obvious thing to most people is that you eat too much, you don't get enough exercise.
You're not disciplined.
Right, and that may be true, but for many it is not true. In fact, for most it is not true. If you looked at the paper yesterday, they had an article with Oprah Winfrey that has kind of given up. She's back to her 200 pounds.
You think you could help her on your program?
I think she should answer some of my emails. That would be a start. That would be a start.
But the answer is, do you think you can help her?
Absolutely.
You could.
Most people that come in to see us have been through other programs, have been unsuccessful, but they've never been in a medication-assisted program. They've never had it treated as a disease.
Okay.
Here's another patient. She's lost 64 pounds, and she's maintained this weight loss for over 5 years. You know, I don't know her particular story, but like most of these patients, it's the improvement in self-esteem and empowerment. Some of them, it's helped them get out and get jobs. Emotionally, they've been, you know, much happier. They deal with their friends better. They deal with life in general better. Plus, of all the health benefits that are associated with it.
So, I had a plastic surgeon on here the other day, and he brought up something different or something interesting. He says, you know, in a recessionary period, that's the best time to invest in yourself. Do you agree with that? Because in a way, they get in your program, they're really changing their appearance, making themselves more marketable.
I agree, but for some people, this is discretionary income. And I've had people call and email me, and they said, "Doctor, can I miss the office visit this month and just send me the meds?" And I say to them, "No, I want to see you. We need to see you, but I'm not going to charge you."
Okay, we need to mention this, and this is true. You're less than all the popular diet centers.
Absolutely.
Weekly, including the medications. I mean, this is very inexpensive.
Well,
in fact, I asked you how much. You told me, you said, I'm embarrassed to even say. So it's affordable. I mean, this is an affordable program. It
definitely is affordable, and since it is my program, I have the ability to give discounts as needed. Plus, many people can get coverage with insurance because of the other associated conditions with weight loss. Because I am a bariatrician, but I also can do family practice, obviously, and had worked many years.
What about that guy? And we're just about out of time.
Well, this gentleman has lost 85.5 pounds.
Wow.
And his current weight now is 232. He began at 317. Like all of them, it just makes they feel better.
Looks like a businessman. So you attract all types of people.
But this fella, I think, has kids who who play on the soccer fields, and he's there as one of the spectators, and he's able to run up and down the fields. He's able to help his kids now. 80 pounds is, almost 300 things. It's a lot of weight, and it makes a huge difference. And he's not done. These are patients that are, of course, all these patients are still in our program.
And that gal looks fantastic.
Yeah, she does look fantastic. This patient began at 175, and she's down 37.5 pounds. She's at 139.
Wow.
She's been in the program for 10 months.
Very pretty.
But we have some patients here that have been in our program upwards of 12 years, because getting the weight off is only part of the program. The key is to maintain the weight. You maintain it how? By staying on medication in addition to the other important protocols of diet and exercise.
And the cravings for most people go away.
Well, that's part of it. Not everybody has cravings. There are a lot of overweight people that don't overeat. There are a lot that don't have cravings. There are a lot of skinny people that eat more than you and I, and they don't gain any weight. So for those, but even if you don't have cravings, even if you don't overeat, this program will work for you because it works by other mechanisms, improving insulin sensitivity, slowing absorption of carbohydrates, and lowering the metabolic set point.
So they will stay on their medications?
They have to stay on their medications if they want to maintain their weight loss.
Okay.
I mean, those studies are abundantly clear.
And so final message, though, people, they've tried everything to lose weight, and it's just not working. They've tried diet, exercise, portion control, their cravings are out of control, or they have no cravings, they still can't lose weight. Final message to them.
Well,
they're skeptical.
If you're one of the 95% of patients who have been unsuccessful and have failed miserably with most weight loss programs, you have to understand that we treat overweight or obesity as a disease, chronic, metabolic, significant genetic predisposition. If you were seeing your physician with diabetes, it's unlikely he would tell you, you've got to eat less sugar and get some more exercise as the only treatment protocols. And the same would apply for high blood pressure. Why would it be any different with weight? We treat this as a medical disease on a long-term basis for long-term success.
But don't those have long-term side effects? I mean, couldn't we have another discussion that would last for hours of all the negative side effects with these medications?
We rarely stop anybody, Randy, because of side effects on this program. We can adjust dosages. We've been using this program now for 11 years and totally 16 years. So the side effects, it's always benefits versus risks.
Do you think this will ever become mainstream someday? What you're trying, your mission, what you're trying to
Well, I've predicted for a long time that eventually obesity will be treated as a medical disease with medication, and by that time, hopefully, I'll be retired.
All right. Well, I want to thank you for coming on the show. Very interesting.
No, thank you.
Your website, all that stuff is on the website?
Yes.
Okay, good. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.